Good evening and welcome to the NORAD School Committee meeting of Wednesday, October 7th, 2020. Want to just briefly start this meeting with a thank you to the NORAD Light Department. As those of you in NORAD know, we were recently without power in a good portion of the town, and more than half of our committee was impacted by that. And we had our 6:30 executive session over phone, and many of us were in the dark, and we're very thrilled to not be in the dark for this meeting. So thank you to NORAD Light for an amazing job, as always, in getting our town back up and running. So first item on our agenda this evening is approval of minutes. And we do have two sets of minutes in our packet, both from September 23rd, both the 7 o'clock business meeting and then also the executive session minutes that preceded that meeting. Is there a motion to approve those two sets of minutes?
Motion to approve.
Thank you, Anne-Marie. Is there a second?
I'll second.
Thanks, Joan. Any discussion? All in favor?
Aye.
Aye.
Aye. All right, great. 5-0. Next is correspondence. Dr. Thompson, do we have any correspondence this evening?
We do not, Madam Chair.
Okay, moving right along to a warrant report. Dave Catania, would you like to share with us about the warrants that you signed over the last week?
Yes, 2 seconds. I just gotta forward it because my power was down, so I'm just gonna get that fixed. Hang on. I'll have that in 1 second. Shoot to myself. Okay, and send. Okay. Sorry for the delay.
That's okay.
Yeah, I couldn't print it and I couldn't email it to myself, unfortunately. So should come through in just a second. I did sign warrants last week, and come on. There we go. Okay. So warrants last week in the amounts of $12,781.56, $3,860.69, $48,780.37, $9,808.48, $20,730.52, $95,786.70, $23,500.16, $23,234.76, $28,530.92, $600, $155,160.50, $175,080.65 for a grand total of $597,855. Thank you.
Thank you, Dave. Any questions from the committee on the signed warrants? Okay, moving right along. At this time, public forum is on our agenda. As a reminder to the community, you can email us at the address that we created for public forum, which is npsschoolcommittee@norad.k12.ma.us. I'm going to just check that email account right now, see if any emails have come in. I do not see any at this time, so I will declare public forum closed at 7:05. But if the community does have anything that they would like to be read at our next public forum in 2 weeks, please email us at that email, and I will read it at our next meeting. Dr. Thompson, any announcements this evening?
No, I have a couple, some information that I will include in my update during the superintendent's report.
Okay. So we do have two guests with us this evening, Sigal Reese, the director of the health department, and also Ms. Kathleen Bishop, who is the chair of the Board of Health. Sigal and Kathy, welcome, and thank you for joining us.
Thank you.
Thank you.
So I know we're going to talk about a couple of important items tonight, a general update, going over some protocol and case scenario, talking about some situations that might be ahead of our community as we continue to navigate the pandemic.
Yeah, great. Thank you. And I do apologize. There's quite a little long list to talk about here. So what, like Teresa just described, I want to hopefully discuss risk level changes, sort of from green, yellow, red to yellow, back to yellow. We also shared a document about the sort of COVID scenarios and what happens in the school and all these, about 7 scenarios. Some changes to the protocols we're recommending. Also drafted a travel guidance for families with to help better understand the travel quarantine guidance. And then at the end, hopefully talking about possibility of offering flu clinics in December, coming up when we're coming close to that deadline for parents to get that required flu vaccine by the end of the year. So that's what I hope we have time for today. But I think the main reason why we wanted to come speak with you was to talk about the risk level change. But before I do, right, hot off the presses, the report just came out a few minutes before this meeting, and NORAD is classified as green, which means our rate is lower. Yes, very good news. That's the first time in 6 weeks. So we've kind of been hopping up and down. In the yellow, we haven't seen a dramatic increase, but it was, ping-ponging back and forth. And so it's nice to see it go down below the rate into the green. So just for you and the public about what that classification is. So there's 4 colors that are designated for a 2-week case count. It's the average daily case count per 100,000. That's the rate. If a community has less than 5 cases, they're actually classified as gray because that's just too small a number to calculate the rate. If the rate is between 0 and 4, it's a low risk green community. Between 4 and 8, it's a moderate risk yellow community. And anything above 8 is considered red and a high risk community. And like I said, the rate is calculated by a rolling average over a 2-week period. And I always want to make the point that the smaller the population, the more fluctuation you see in the smaller number of cases. So 1 or 2 cases makes a drastic impact on our rate versus you look at Boston or other larger jurisdictions, 1 or 2 cases is not going to have much of an influence on their rate. And that's because it's calculated per 100,000. So just to say, we might see bigger swings just because we have smaller case count differences than, let's say, again, a larger jurisdiction. So DESE has issued some guidance that stated communities should wait 3 weeks before pivoting to fully remote, 3 weeks in red. Like most things with COVID, it depends, right? So if there's a cluster, let's say associated or in the schools, we might not want to wait 3 weeks, right, before we pivot to fully remote. But then again, on the other side, if there's a known cluster, let's say in a nursing home or another facility that's not connected to the schools, maybe we want to wait 3 weeks or even more. So I think the point of the conversation I'm hoping to have here is that it's not an automatic trigger. And we're hoping between the two, the board and the committee, kind of come together, maybe have a joint meeting and sort of talk about how we would want to move forward. How can we share the information with both groups? So everybody has the up-to-date and the facts on the ground to make a decision.
Thank you, Scott. I think it's really important what you just said, that if we go red once, it's not automatically that the schools go remote. And I know there's been some confusion and miscommunication just in the general public around that. Does anybody from the committee have any questions so far on the risk level? And if we do go to red, Maya?
One question I have is, given our community size, how many cases in 2 weeks does it take to push us into the red? Like what's that threshold?
Sure, that would be 34 cases. So anything below 17 in a 2-week period would be green, 17 to 34 is yellow, and then 34 or more would be red.
I think that's, 34 cases doesn't actually sound like that much. It seems like, one last could push us easily into the red. And so I just think it's important for people to realize that these are kind of, red sounds big and scary. And I'm not saying we want to go into the red, but I just want people to be aware that it doesn't take much to push us into the red.
That's a great point. And today was a perfect example of the difference between 16 and 17 cases would have been the difference between green and yellow. Are we at any higher risk because we have 17 cases versus 16? No.
Yeah, Joan?
Just say after that conversation, still wear your masks. Thanks.
Yeah, that's a great point. And then the reason we want to look to the reasons why we're green. I mean, it's hard to point to one thing, but they say, good job, you guys, NORAD's doing the right things. We're taking the proper precautions and we need to continue that. So that's a great point. Yes, still wear your mask, still social distance. It doesn't mean we can sort of let down our guard in any way.
And Sigal, just to be clear for everybody, your department has the ability to really access and analyze that data to help us as a school committee in conjunction with the Board of Health to determine after a week or 2 or 3 of being read where that cluster is. So we will obviously continue the strong partnership that we have with you.
Yeah, we will definitely know those details on the cluster, sort of where they are and the nature of them. Also, you know, what I see is a more difficult scenario is almost what happened today, but let's say it was between yellow and red, where I sort of have an idea of where the number is, but the number's constantly fluctuating in the database because things are always changing. Every minute the number could be different. You know, if we're correcting addresses or cases are removed or cases are added, so it's always a number that jumps around. So when you're really close to the line, you know, I might want to call, you know, maybe a group meeting of the 2 boards to say we might be close to red, or at least put people on notice. But I might not know exactly. But if we're way over or way under, I will definitely know ahead of time, ahead of the Wednesday evening report. I should, and I don't think I mentioned at the beginning, the report comes out weekly every Wednesday. It's supposed to be by 6 p.m.
Joan, did you have another question?
Yeah, I have a real question. Is there any with the change from if we were to go to red or if we but still stay hybrid, or now that we're in the green, is there any recommendations around changing some of the restrictions now that we're more in the green on some of the things? So I know that, you know, playgrounds and playing tag and some of those types of things for elementary school kids, you know, when we're in the red, is there an opportunity for high school kids to be doing more congregating? Like, will be there? Well, is there going to be any suggested change in protocols on a more minor scale based on where we're at in that color coded scheme? Is that correct?
Nothing. Yeah, I get what you're saying. Nothing in regards to like gatherings or you know, playgrounds or things opening and closing. The only caveat to that is actually this week we started low risk communities. Now, just to complicate, low risk communities in the phases means anything yellow, green, or gray. So when we're talking about the reopening and the safety standards that are applied with that, the low risk communities, anything that's not red, were allowed to go to phase 3, step 2. If you were red or had been red in the last 3 weeks, that community stayed in step 1. So if we go red for a couple weeks, we might go back to step 1, which was really, to be honest, it was about public gatherings could increase to 100 and some capacity increases from 40 to 50%. It was a very small change, really, the step 2. So no drastic differences in policy as far as, you know, gatherings, sporting events, the safety standards in retail and for the schools, no drastic difference there either.
Any other questions for Sigal just on the risk level before she continues with the other protocols and scenarios? Okay, Sigal, you want to continue?
Yeah, so I was just going to say, so I think if the boards are in agreement, and Kathy, it was kind of the idea we talked about was that bringing the 2 committees together. If we think we're close to red, maybe a notification. If I know, you know, if we have the signs that and the numbers that we are going to red, even that first week, pulling the group together to talk about it. I think the 2 boards together have a joint meeting.
Definitely. I think it's important that we keep the lines of communication open and that we don't wait until the very last minute. That'll make everybody anxious. So if we can get ahead, you know, if we know that the numbers are going in the wrong direction, then we're going to be close contact with you to get something set down so that we give the parents enough time if we have to go to remote. They know they're going to have to go, not just like an hour later, okay, everybody's remote. So I think the communication between both boards will be extremely helpful.
Okay, so I think that lays out a good plan for us. And you know what? Hopefully we don't need it, right?
Right.
So the second thing I want to talk about, did all the members get the 6 scenarios, the 7 scenarios document?
They did, Sigal. So that should be in everybody's packet and linked on the agenda as well.
So my main thing was just to open it up for questions. We tried to sort of lay out in a way where, you know, staff could, it's meant as an internal document, but it's definitely, we could share it with the public. but it's the idea of just laying out different scenarios if there's a COVID positive person, if somebody is in quarantine, if a family member is positive. So sort of allowing everybody to be on the same page on how we're going to respond to those scenarios. So just here to answer questions.
Any questions from the committee as you reviewed those, Joan?
Can you walk through, I just want to make sure I understood what was written. Could you walk through the notification procedure recommendations if a student tests positive at the elementary, junior high, and high school levels?
Sure. So that's kind of scenario one, right? We have a positive student. Yep. I'm just reading it.
Yeah, I understand the contact tracing. My question is really around the notification of students who may not have been classified as close contacts, but say we're in the, actually, I'll just put that out there. Who would be defined as close contacts at each one of those levels, and who else would be notified at each one of those levels?
Sure. Well, let me start. The second part's the easier one. So we will be notifying the classroom and the whole school where the student was. That's definitely something that we've talked about, and we all agree. The whole community, school community, would need to know that, whatever school it's at. As far as the contact tracing, so we apply the standard that we apply in every scenario is anybody within 6 feet of the individual for a 15-minute length of time. Understanding in a school environment, particularly the high school where students are moving around a lot, that can be very difficult. So really working with the staff and the school nurses to identify those close contacts. That's going to be our priority, honestly, as far as communications, is doing that investigation, figuring out who those people are and reaching out to them immediately to place them in quarantine. The good thing with COVID and most infectious diseases, it's not an instant thing. So just after your exposure, you're not contagious the next minute or the next day even. It's usually, 4 to 5, 6, it can be as many as 14 days, right? That's why we have a 14-day quarantine. And you might never get the disease. Exposure doesn't equal disease. Exposure just equals higher risk and chance that you might come down with the disease. So that's why we sort of draw that line around the 6 foot. We know your risk is higher within the 6 feet and closer to be exposed to enough viral load where you could possibly get it. It's all about percentage and probability, right? So there's a higher chance the closer you are to the individual that was positive when they were infectious. So we apply that 6 foot, 15-minute conversation standard and try to do the investigation, figure out who meets that criteria to the student.
Does that change now that the CDC is saying that it is airborne? So 6 feet away would be potentially nobody even in that classroom that a kid's been sitting in for, depending on the age level, 50 minutes or a whole day.
Yeah, so it's curious when the CDC issues that. We've always known that droplets can travel beyond 6 feet. What it is the risk of being exposed to enough respiratory droplets beyond 6 feet is drastically reduced. So if you're within 6 feet, there's a higher risk that you're going to be exposed to more droplets. So like I said, anything beyond 6 feet is lower risk. And you really do more harm by placing someone in quarantine, either to a student, or this is the same standard we apply to the general public when we do it. So you apply more risk when you place someone in quarantine, and the risk of their exposure is so small. So we know sometimes the droplets travel beyond 6 feet, but the chance of you actually getting the virus with that little exposure is very low. So it's that probability chart that you imagine where it's really high the closer you are, and it just goes down, 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 down the further you are away. And public health experts sort of draw that line at 6 feet. And when you go beyond that, your rate of getting the virus is so low that we say, hey, you know what, it's more harm putting someone in quarantine, because that's a big deal. That's putting somebody in their house for 14 days and saying you cannot leave at all for any reason, minus emergencies. But it's pretty drastic to put somebody in quarantine. So what we want to balance that harm with the risk of getting the virus. And that sweet spot, that we're always trying to find is anybody within 6 feet for about a 15-minute length of time. And we've talked about this a lot with the school administration, that we're always going to take a conservative view of that. If we can't determine, or we think it was 12 minutes, or it was 5 minutes here, 5 minutes here, and 2 minutes there, you know what, we're going to err on the side of caution. We're going to put that person in quarantine. And again, trying to always strike that balance, but really taking a cautious approach to it.
Sagal, would you talk a little bit more? We had talked in our group with Dr. Thompson and Stacey Lane and Ms. Bishop about communication in a school setting is a little different than communication in other places where you're doing contact tracing, because when you do contact tracing in other areas, you're only contacted if you need to be quarantined, if you are identified as a close contact. But we were discussing an additional layer of communication here with the classrooms, even if you're not a contact. Do you want to talk a little bit more about what parents and staff can anticipate with that?
Yeah, I think what we've talked about is something along the lines of, that there was a positive case in the class. Everybody that we're hoping the timeline works in that the sense that we will be able to contact the close contacts first. That's always our choice to do that. And then send out a general statement to say an individual in the classroom was positive for COVID-19. All the close contacts have been reached out to and are placed in quarantine. But that we think it's fair and want to be transparent and let everybody know that that case was there, but that they were not at risk of exposure.
Thank you. Are there other questions about this scenario that Joan brought up? Or questions about the other case scenarios that you have in the document in front of you? Dave?
So I see that, like, when we have somebody at a home where somebody's being tested, and they don't have the result back, stay home at least for the couple days it takes to get the test result back. Why do we make that decision instead of saying, like, hey, some of your house is actually concerned enough to get tested, you should just stay home for until that test result comes back in a couple of days?
So one reason, it depends why they're being tested. So if they're being tested because they have symptoms versus being tested because they're a close contact. But we're looking at, I think, the report that came out tonight, it's a 0.91% percent positive. So 99% of our cases are coming back negative of our tests. So there's a lot of people being tested that come out negative. And plus we have that time span. So again, just because you were exposed on day 1, you're not contagious on day 2. It's going to take some time. So you have that ability to wait for the test results to come back before you implement that pretty drastic measure of quarantining somebody. So there's that individual that lives with the person being tested is that no, they don't have the virus, they can't transmit it yet. So there's no reason to exclude them from school or work or whatever the environment.
And to clarify, Skull, that is if the individual who lives with the family member who's being tested is not symptomatic. If the individual themselves is symptomatic, that is a different conversation, a different process.
It depends. It's COVID. I always leave those caveats that, if they, again, getting back to, I think we talked about last time, those 3 different types of tests, there are scenarios where you might have a positive antigen test, which is the rapid test, and the person is symptomatic, we might start treating that like a case. So that was sort of the scenario I was thinking in my head with a symptomatic individual. And then we might start quarantining the family at that point, but we're still waiting for the diagnostic PCR test, which is the kind of the gold standard that we want. So there's always those little caveats, but for the most part, if somebody's awaiting a test, we don't start quarantining the family yet.
Joan?
Yeah, you're going to have to break down the difference in those tests, like into layman's terms, because there's lots of people talking about how they're going and getting tests.
Yes.
Could you give us just a little bit more of a breakdown? How would you know what type of test you're getting? If you're getting tested because you're traveling outside of Massachusetts and we require a test, like there's so many reasons people could be getting tested right now. It would be great if we could know the difference and understand how to, like, if I go and they can give me my results in 2 minutes, is that a good test or not a good test? I'm guessing not a good test. So yeah, if you could help us out with that, that would be great.
Sure. There's no bad test. They all just serve different purposes. So let me just do the easy one first. The serology test, which is the antibody test. That is the bad test, we'll say. That's useless. That just says at some point you were exposed to COVID-19. So let's put that one aside. That's the antibody or serology test. The 2 tests that we're seeing more now are the PCR test. That is the gold standard. That's the diagnostic test. And that looks for the RNA of the virus, the DNA of the virus. Very sensitive test. So a positive PCR is what we call a confirmed case. That is when we talk about test results and tests, that's usually what we're talking about. Then there's the antigen test, which tests for proteins. and they're all nasal swabs too. So the antigen test is the one that comes back quickly. That is less accurate. But again, erring on the side of caution, if we have a positive antigen in someone that has COVID-like symptoms, we're going to start treating that like a case. And if it comes back PCR negative, we'll pull it, and then you just cancel everything you did. But as a precaution, you start treating that like a case. So antigen case, proteins, less reliable, PCR test, gold standard, diagnostic test, antibody, serology test, we don't care about it. The state says you don't even have to call those people anymore, because all it says is that you were exposed at some point. It could have been, 6 months ago.
So for the antigen test, is it less likely to detect, when you say that it's not as reliable, it's less likely to detect positive? And so someone could potentially be asymptomatic and spreading, or they could be symptomatic and they get a negative antigen test and they actually do have it because that test is less sensitive. I'm just trying to get at kind of like, what do you mean when you say like less reliable?
And of course, I'm forgetting. I think it's that they have false negatives.
Yeah. It's
Yeah, and
possible.
so my staff's going to text me right now and say I got that wrong.
I believe, Scott, it's possible to have a negative antigen, but then a positive PCR. So if we're telling families to be tested, we want the PCR, because if they give us the result of the antigen test and it's negative, it doesn't necessarily mean that they're negative. And Dr. Thompson, correct me if I'm wrong, but all of the communication that will now go home from nurses, if a student is suspected in school of having symptoms, we are being very clear with families that it is the PCR test required to come back to school, correct?
Right. We had used the terminology nasal swab tests, and somehow people were missing that. So now we're using both PCR and nasal swab in that communication. And if your child is being sent home because they are showing symptoms, we're asking to test, there is a letter that goes home from the school nurse. Please bring that letter to your doctor. So and again, there are people who do it quickly and people who do it thoroughly. And we're kind of seeing both, where doctors are just doing rapid tests. You probably want both tests being done simultaneously. That would be this doctor's recommendation, not a medical professional.
Yeah, we definitely say if you're getting an antigen test, do a PCR at the same time. We to be honest, we care less about the antigen test. If they just do the PCR, we're fine with that too.
Yep.
But we're always trying to tell the medical community, run that PCR too. Don't just do an antigen. And most physicians know that and run them both. It's just they want that quicker result of the antigen. That's what that serves as. But it doesn't become a confirmed case until we get that PCR, which does usually take 2 to 3 days, sometimes quicker. While we're just on that topic, another thing on our to-do list is I guess there was an incident in Rhode Island, I think in Providence or North Providence, where the health department reached out to the schools about a positive student, was not able to reach the superintendent, so just stopped. And then the child attended school on Monday because it was over the weekend. So what we would like to do is make sure we have a nice phone tree. We're a smaller community, so we all know each other. We all have each other's cell phones already. So I don't see that happening, but you never know, someone's sick or something happens. So having a sort of first, second, and third people to reach if that does happen over the weekend or something like that. So that's for our next meeting. I'll just put that out there. But we want to create sort of a call list. So if I think we're all done with the scenarios.
So I know that this document before us tonight with the level of detail, some contact information of staff is the internal document, but I believe we discussed that after, this is shared at next week's Board of Health meeting. So that board has a chance to discuss it and ask questions as well, that we did want to adapt it and release it to the community. So the community understands the scenarios and what to expect if these different things happen, correct?
Yeah, I would be agreeable.
Okay.
Yep.
So our next topic is travel. This I felt was a little easier to display visually. It's a little simpler than those scenarios. So we created sort of a flow chart to talk about travel to high-risk areas or international travel and what's required. And again, when we talk about tests here, we're always talking about a PCR test. That's the only way. Let me back up. So I like to always call it travel quarantine because it's different than regular quarantine. If you're in quarantine because you're exposed to a confirmed case, you can never test out of quarantine. You have to finish your 14-day quarantine. Even if you test negative, which we advise people to get tested, but if you test negative, you still stay in quarantine because you could convert at any time in that 14-day period. When you travel, it's sort of an extra precaution that the state is taking, is putting into a travel quarantine. So we ask that the people quarantine when they get back from high-risk areas, fill out the travel form, tell them what your plan is. You're either going to quarantine for 14 days or you're going to get a test, or you had a test 72 hours or less before coming back to Massachusetts. So those are the three scenarios. When you come back to Massachusetts, you are in quarantine until you get the test results. So whether you had it, sometimes people travel with the test results a couple of days before they came, but most time when people are returning to Massachusetts, they're Massachusetts residents, they're going to get it when they're here versus on their vacation or trip. So they are in quarantine until they get their test results, not just get the test. So understanding that a child can't go to school until their test results are back if they travel to a high-risk area.
Since this is the flow chart and the visual, do you want Dr. Thompson to pull it up and share it on the screen just so the community can see what we're referencing with this one?
If you want, if he has it.
Are you able to do that, Dave?
Yeah, I'd have to go back and find it.
It's linked. It's linked on the agenda if you have the agenda.
Okay, yeah. All right, then I can do that.
Yeah, it's the first one under update.
Just while he's doing that, I'll get into one of the confusing points about travel, which is the children under 10, which is obviously going to affect the schools. So if a child under 10 travels with their parents and their parents get a test, the child actually doesn't need a test. It is assumed that they had the same exposures as their parents. So the parents' negative test would constitute their ability to stop quarantining. And that's that sort of box up at the top right. If they travel without their parent or guardian, then they do need that test because obviously they didn't experience the same exposures.
Segal, could you clarify for everybody who monitors this process? This is your department, correct?
Yes. So the travel form, it goes into a state database and then that is shared with the municipality. It's just a huge database of everybody that fills out the form. So if there's a question, about somebody's travel form, we can access that information. It is self-disclosed though. I mean, people need to fill out the travel form.
Did anybody else have any questions about the travel order and what this process will look like?
Can I add, I'm going to put you on the spot, Segal, but what if someone doesn't do a travel form and then it's discovered that they had not followed the procedure? Might as well put that one out there.
Yeah, well, we contact them and do an interview and try to enforce the travel order as best we could.
Okay, and then ultimately they could be fined? Isn't it $500?
Yeah, I don't know of anybody that has done that in the state. It is, the end result could be a fine of $500, yes.
Per day, up to 14 days.
Yeah.
Yep.
It adds up quick. So don't violate travel orders. Any other questions on this piece? And Dave, will this go on our website or how are we going to jointly with Segal's department and schools get this information out?
Yep, we can put that out and make sure the schools have it as well.
Okay, and then so my last topic I was hoping to discuss with the committee was about the possibility of flu clinics. So the health department offers flu clinics to the public and to school staff, mainly in October and November. We will probably finish our allotment of vaccine in early November. So there was an opportunity to work with the private pharmacies to bring flu clinics to the schools. Thinking in December, like I said, as we come up on the end of the year deadline for the students to get their vaccine. The only thing the schools would really have to do would be to send out the link to registration, provide the space and tables and chairs. I expressed to CVS, who has approached the town about it, that there's no way there can be a heavy burden on the schools to do this, that it needs to really, the work needs to be on the pharmacy to do all the legwork with this. And especially the nurses, that they're not going to be doing screening or collecting registration or anything like that.
So basically we provide the space and they provide everything else?
Yeah, they did say tables and chairs they would need set up. So it does have some custodial work and, you know, in the cleaning that need to go after. So, I mean, there is some work for the staff for sure, but I would try to keep it as minimal as possible. And I would say at that point, like it wouldn't just have to be the students. They do 3 and up. So families could come, staff, parents, you know, any opportunity to get vaccinated, we're in favor of, and the better access. You know, we always want to improve access to vaccines.
Mm-hmm. Maya, did you have a question?
I just wanted to know if Sigal could tell us about what this new flu vaccine mandate is.
Yeah, so just like all the other vaccinations, just it's required for students to have it, and the same exemptions would apply that normally apply to vaccinations. We have a very high vaccination rate in Massachusetts anyway. So it was really just another 10 to 20% of the students that don't get vaccinated that we're trying to get vaccinated this year because of how complicated flu can, and how similar flu is to COVID, and how that can really complicate the testing and diagnosis in the healthcare community. Mm-hmm. Taking care of flu. You know, we always get busy during flu season anyway, and now add COVID on top of that. It's a lot.
Mm-hmm. Dr. Thompson, since this is a little bit different than the regular vaccines, because, you know, usually as a parent, you just submit your child's physical to the school nurse and the vaccination record is on there. But this is a little bit of a different mandate. So if families, when families get their children vaccinated, what should they do? Who should they send?
They should ask for they should ask for a piece of paper that says that their child got the flu vaccine and then bring it to the school nurse.
And just to be clear, that the current mandate in Massachusetts is that all students, even those who are in the remote learning academy, are required to get the flu shot unless they meet one of the exemptions by the end of December, correct?
Yes, December 31st, correct. Yep.
So for RLA families, should they just send the information into their homeschool?
Yes.
Any other questions from anybody on the committee for Sigal or Kathy?
Yeah, and if I could just make a quick comment, because this is a little bit different than what we've done in the past. You know, you have certain kids of certain age that will be providing vaccinations to the school nurse. So it's, you know, 100 or 200 kids per school. We're now asking for entire schools. So I would definitely make a copy of that piece of paper and send a copy in, please. Don't send the only copy you have, because then you're going to be rushing like everybody else to the doctor to ask for a second copy, and that's going to be a problem if you have it done at a pharmacy. So keep a copy in a safe place and send a copy in, which is good advice for any of that information. But yes.
Anne-Marie?
Just a quick question on, I don't want to get too nitpicky, but will there be flexibility on, you know, official letterhead, things like that? Because I actually have done myself the CVS flu clinic in my company, and my child went to a flu clinic at the pediatrician, and neither one gave any kind of piece of paper, and they weren't even available at the clinic. So I was able to go into a computer system later and print something out, but it's not on official letterhead, things like that. So I want to see what kind of.
Yeah, well, I mean, you know, and I just got it, right? It just has my name, and it has the whatever the official name of the flu vaccine is on it, and the person who gave it. So, and that's printed out. So,
and it might just be just as a kind of a heads up to parents that I've already done it for myself twice, that you may need to think of this ahead of time, and asking for that, because I didn't know that that type of thing wouldn't be available, and I would have asked for it ahead of time.
Anything else this evening, Sigal, that you want to share with us?
No, thank you for taking the time.
Yeah.
Always here for questions. So.
Yep.
Oh, Maya?
Well, I just wanted to thank Sigal and Kathy Bishop for joining us, because I really think it's been great that there's been such a strong partnership between the schools and the Department of Public Health. And I have heard from other school districts that haven't been experiencing the same comfortable relationship, giving everybody additional confidence. So I really want to thank you for all of your efforts, and then to, ask Segal, are there things that you as a health department need at this point, or do you guys have adequate resources at this point?
Yeah, well, we can always use more. but we're good. We're good for now. But yeah, I always have plans for the department for more services we can bring the community. But for COVID, we're doing well. We do have the support of the state contact tracing collaborative, which is helpful, and it's definitely a two-way street with the schools. So I want to thank the schools too. We have a very easy relationship, and I appreciate that. And really, the support of the whole community and the whole government across the board has been really great and helpful during this pandemic. Everybody's been willing to work with us and listen and compromise, and I appreciate the support from everybody.
Well, we definitely appreciate your support. I was in a superintendent's meeting this afternoon, and we are the outlier. Not everyone has the relationship that we have, and that I'm just thankful it's one less headache I have right now. So, but all that support, a lot of conversations, and it's been great. But again, it's about the community, it's about our kids, and making sure we're doing the best we can to make sure everybody is safe, in Norwood. So, and that's a team effort and a group effort. So, thank you.
Great. Thank you.
Well, thank you again, Segal and Kathy, for joining us. You're welcome to stay on with us, but you certainly do not have to.
Thank you.
Thank you.
Thank you, Kathy.
All right, so moving along on our agenda is Dr. Thompson's update.
Yep. Let me just grab the PowerPoint here because it's just a little easier in this medium to do it this way. All right, so the first thing I'll point out is that you'll see that it says NPS update. We're already open, so we're not reopening, so I lost that piece, but just to go through for this one, I'm going to talk a little bit about our great start, a little bit of information on the calendar, and I will ask the committee. This will probably be a multi-step process in getting the calendar updated, and then talk about next steps and reminders at the end. So off to a great start. This was a tremendous amount of work. We were lucky to have those 10 days, be able to vet our systems and processes with our teaching staff, make sure they were trained and knew how to do all of those things that we need to do to make sure our kids are safe. You can see the desks are separated. The kids are all facing the same direction. Masks are being worn. We have sanitizing wipes if you walk into any building, which unfortunately our buildings aren't really open to the general public, but there are arrows and directions and reminders to be 6 feet apart all over the place. Sanitation, the hand sanitizer in and outside of classrooms all over the place. And the other thing I just want to share with you is that each school has put together kind of a safety video to demonstrate those, and I just want to share a couple. The first one I'm going to share is the high school one, and this one was actually produced by our high school students and our Norwood High School TV. So let me play this for you. Hopefully you can hear it. My first time trying to play a Google video on. Oh, come on. All right, maybe I'll try the other one first. Okay, let's try this one. Can you see that video?
I don't see it. I'm not sure if others do.
I don't see it.
All right, let me go back over here and share the tab. This one's from the Ball School, but each elementary school is doing these. All right, we're not getting much cooperation. I'm gonna leave that going in the background, and we'll see if we can come back to it. Maybe they will load. Don't know why. It should be, but anyways, all right, we'll come back. But the point is, and these are actually on the webpage if you want to go back and watch them. The high school one was also put on the Facebook page earlier on, but it goes through all, and the high school one is about for the high school students, so they knew how to travel in and out of the building and what the processes are. The other ones are basically for the parents, so they know what these safety protocols and procedures we put in order are. So I'll come back and see if they can. We've also done structural improvements. We now have bottle fillers replacing many of our water fountains because we can't really have kids slurping out of water fountains. So we've added those, and these have filters in them as well, which is an added benefit. And then I kind of want to go and talk a little bit about the calendar. You remember last time we were together, we talked about the holidays and looking at those during the year. And actually, because of the Thanksgiving break and the December break, and those starting on Thursdays and Fridays, the holidays, when we count the Monday holidays for the year, are equal. So we didn't need to make any changes there in the school calendar. And I told you we were going to go look at the half days and try to move as many as possible to Wednesdays. And then the next step that I'll be coming back to is we need to talk a little bit about the marking terms. The first marking term, especially at the high school and middle school where they're on quarters, is difficult because they often don't have enough grades. Well, we lost 10 days of teaching and grading and assessing. So we need to look at moving the marking terms back a little bit so there'll be more opportunity to do that and be able to give a reasonable assessment. That's going to be discussed over the next 2 weeks, and hopefully at the next meeting we will talk about that. But I want to go back to the half days. I don't need to thank Dr. Wyeth for his work on this. So we've looked at all the half days, and we have moved all of those except 1.5, if you will, to Wednesdays. And our thought with doing that is that parents have already made accommodations for Wednesdays because there's a half day remote remote instruction in the morning and independent work in the afternoon. So parents have already worked on Wednesday coverage, if you will. So we wanted to try to help parents out and not add another stressor in the week there. So unfortunately, the one that we cannot change is Tuesday, December 8th. And that is our understanding by design at our high school and middle school. And that does need to stay on December 8th. We cannot get this person who does this is very good and in very high demand. And we don't have the flexibility of changing that to the 9th because that person is not available. So that is the one exception where we will have to keep that Tuesday as a half day for PD. We are looking at changing Friday, November 13th to Wednesday the 18th, the week following, and that's parent conferences. Changing March 4th to Wednesday the 3/3, and that is also parent conferences. That's grades 1 to 5 only. Change Tuesday, the 23rd of March to Wednesday the 24th, and April 1st to April 7th, Wednesday, April 7th, and those are ELA PD days for our new PD program. And then looking at May 7th and moving that to to May 12th. For pre-K to 8, we would keep Friday the 7th at the high school. That is the day of the prom. That is when the prom is scheduled. It's also an AP testing day, so we really can't move that. Hopefully we will have the prom. So that I am asking that the committee would make the following changes to the school calendar, and they're up there 2, 3, 4, 5, and 6. I don't know if there's any questions that anyone has before we go back. But the whole idea was to get them on Wednesdays if we could. We had 1.5 instances where we really couldn't.
Any questions from the committee, or is there a motion for these 5 changes?
So moved.
I'll second.
Thank you, Dave. Thank you, Maya. Any further discussion? All in favor?
Aye.
Aye.
Right.
Okay, 5-0.
Thank you. And again, I want to go back and again, thank you. Thank Dr. Wyeth for his work on this. He's been working on it for the last 2 weeks. And even up to the last hour was trying to get the December date changed from the 8th to the 9th, and we just can't do it. And that is a really important program that we need to have to help move our district forward. So we kind of need to keep that. So moving forward. So next steps. So we had this Wednesday collaboration time, and I had the chance to sit in on some of that this morning at the Bulge. So teachers are using this time to develop lessons, work on their craft, and again, our staff. I told everybody that everybody is a first-year teacher, everybody is a first-year principal, and first-year superintendent or central office staff this year, because this is totally new. This is something we've never imagined doing. But the whole idea is that we're facilitating continued growth and improvement. We're off to a very, very good start, and I've complimented the staff, the teaching staff, and our administrative staff on how well we have started with this. And I can tell you, and I've shared with members of the committee before, it is absolutely so heartwarming to be able to go in and see kids in classes engaged. And I visited online classes by walking in and seeing teachers and seeing kids engaged and happy to be learning. And it's just a testament to the professionalism we have in the Norwood Public Schools, the work that we started last spring and over the summer, the safety measures. We were an early adopter and pilot district for the Palabra project, so that we got a lot of information from them on how to open and how to design and how to look at our systems, and that helped us as well. But that's, looking at this support time and these Wednesdays, that's going to continue our growth, our meeting kids. The one thing that I have noticed is having half the class in there, they're really getting a lot of individual teacher time because those classes are, when they are in person, are much smaller. And several, especially in first grade and second grade, have mentioned that they're really able to move kids forward because of those small numbers. We're still hiring and need to hire support staff. We're lucky in that there's a good number of our paras who are certified teachers that have moved into some of these teaching positions that have opened up due to our expansion. But we need to backfill some of those. So we are looking for paraprofessionals, and we are starting to work on the strategic plan. We're doing a training tomorrow afternoon on that, looking at processes and to develop our action plan for the next 1.5 years, 2 years. So those are our next steps. And then in closing, I need to remind everybody. So our ability to continue, and it was great news to hear that we are back in the green, but our ability to continue with offering the programs, the band, the orchestra, we're working on that right now, sports, all of those things require adhering to mask wearing and social distancing. And the parents need to reinforce this. We cannot have what we've seen in other towns around us with kids getting together, not wearing masks in large numbers. That is just a recipe for disaster. And even when I go out and grab some lunch and to bring back to my office, I see kids sometimes, moving around in groups and not wearing masks. And again, we just need to work together as a community to reinforce that they need to wear masks. They need to keep their social distance. You can still have friends, you can still hang out, but do it safely. Do it from 6 feet beyond it and wear your mask. And again, our work continues. We're off to a great start. We're not done. We're not there yet. We're not perfect, but we're working towards constant improvement. And we do appreciate everyone's patient with that. And once again, the good news that we are not looking at having snow days, that those would be remote days. The one exception would be if we had a massive power outage. But in Norwood, I don't foresee that being a huge issue where we have Norwood Light that does such a fantastic job. So, so that's where we are. So I don't know why I can't get these up and running. So I don't know what is going on here. Hang on, maybe if I reload it. That will help. Reload this one too. Reload the whole tab. Okay, maybe this will work. Here we go. So here's the first one. This is the high school.
Welcome back, Mustangs. We hope you're excited to start the new school year.
We will be introducing you to the new safety guidelines of NHS.
Let's get started. NHS is open for students at 7:17. There are 3 ways to enter the building. Door 17, door 3, and the main entrance, door 1.
Make sure you wear a mask before entering the building. It is required at all times.
Follow the signs on the door to ensure you're going in the right way.
Good morning, Rose. Remember, go straight to class.
If you're not getting breakfast, make sure to go straight to class as soon as you enter the building.
There will be no walkers or hanging out in the hallways.
The hallways are now one way. They're marked on the floor to show you which way to go. Staircases in the building are now marked either up or down. The main staircase will be up all day.
However, at dismissal, the main staircase is designated for going down. Since the hallway is now one way, side-by-side walking is totally okay.
Just make sure to keep your distance 6 feet apart. There are hand sanitizer stations to be used throughout the hallways. When you enter the classroom, make sure to go straight to your assigned seat. Definitely place 6 feet apart to maintain social distancing.
There will be a set of wipes in each classroom. At the end of class, it is required to clean the desk and chair.
Unlike other years, there will be no bells. Your teachers will dismiss you. Mask breaks are allowed throughout class. Just simply raise your hand and ask the teacher to step outside.
Remember, can I get a mask break?
While you're not using water fountains this year, feel free to bring a water bottle and use the station to refill.
New this year, NHS has opened up the courtyard. This is available for all students to use as an outdoor hallway.
While using the courtyard, make sure to maintain social distancing and follow the one-way path. If you need to go to the nurse, get a pass from your teacher.
The library is closed for further notice. However, this is used for overflow classrooms and classes over 12 people.
If you want to go to guidance, make an appointment with your guidance counselor. If it's an emergency, ask your teacher to call down.
At the end of the day, go home, grab some lunch, get ready to walk back on.
We hope you have a great year. See you soon. Stay safe, Mustangs.
That was excellent. Really excellent.
Yeah, so that was produced by our own students, developed and produced by our own students. The other ones were produced by NCM. So this is just an example. It's just the Ball School, but each school, the middle school, and all the elementary schools are doing these. So we'll play the Ball School next.
Hello, everybody. My name is Diane Ferrer. I'm the principal of the Balls Elementary School. I'm happy to report that all of our students have finally come to school, and it's been a really seamless opening start. One of the changes that we made this year to start off the school year is how we get to school. So before, in the past, all students would come, we'd meet, we have a car line and a bus line. All students go to the back of the school, they hang out, they play, and we all came in the same door, door 7. Well, not this year. This year at 8:25 in the morning, kids are welcome onto the property, and they each grade has their own door, and they come in their own door and go straight up to the classrooms. No more gathering as a group. One of the other changes we made is outside every single classroom is a hand sanitizer dispenser. So on the way in and on the way out, every single time they go enter or leave the classroom, they're getting hand sanitizer and they're cleaning their hands. Upon arrival in the morning, one of the first things the students do is go to the bathrooms and wash their hands with soap and water. Attendance is taken, the day starts. We break mid-morning for a mass break and a snack break, which is often done somewhere outside. The kids like that. They kind of, it gives a break from the mask and it gets kids outside, and they'll have a snack and sometimes a short recess. Not on a schedule, kind of on the teacher's schedule. And then in the lunchroom, we've also made major changes this year. We used to have cafeteria tables like we're all familiar with when we went to school. Not anymore. We have desks. Our desks, we can fit about 54 kids in there safely. It's 6 feet apart, and so we have 54 desks in there, and the students have, each desk has a number in the corner in their assigned seats, and the students come in, they sit at their desk. The meals, they don't walk through the line like they used to. They order in the morning. The meals are prepared before they get there, and when they show up at their desk, quite often the meal is waiting for them. In between, the students, after we clean up, we bring the barrel to them. We have the wipes that they use, and they sanitize and clean the desks, and then the next group comes in. That's been working out really well, getting all the kinks out of that. We have a new ordering system in the morning. It's paperless, where for years it's been a piece of paper going back and forth between kids delivering it, and now we use a Google spreadsheet, and the orders get in, and the cafeteria gets them. There's a seat number next to every kid's name, and that's been working out beautifully as well. One of the other exciting things is we did get a new playground here at the Balch, which has helped us immensely to separate kids out. So when we assign recess now, you either are on the hard top, we might go down below. We have the old structure and the new structure, and we do it by day. So only one group of kids gets each area for a day, and then the next day we change it up. So all kinds of things are happening that are exciting like that. It is a change. There are fewer kids in the building at a time. We have smaller class sizes, which is actually quite nice and good for catching up kids on some of the instruction they may have lost last year. But so far, so good. It's been good just to get the kids back in the building, stop thinking about things, and start just seeing them in action. One of the other changes that will be happening and coming up soon, most of our families are familiar with an ice cream social open house night that we've had every year for as long as I can remember. But we will be having a Meet the Teachers night, which will be a virtual open house type meeting coming up at the end of October. So the 27th looks to be our date. It's Tuesday. More information will follow. But another slight change to what we used to do, but it still gives people an opportunity to meet their teachers and find out what the expectations are and see how things are going. So that is very exciting. And then in closing, I just really wanted to thank our buildings and grounds, Paul Riccardi and his crew, the guys who work in my school. They have been vigilant in the cleaning daily, Wednesdays with the sprayer, and actually even more than just Wednesday with the sprayer. But they've been doing a nice job in our buildings, keeping them super clean, staying on top of things, really being there when we need them, and anything we need, they have done for us.
Dave, you're muted now.
Yeah, there we go. All right. So each of the buildings have done a video kind of explaining what the changes are. I mean, it does, when you look at it, it does kind of demonstrate how we've had to kind of rethink almost every single aspect of schooling in Norwood. Everything from lunches to entering buildings to moving around the building, all those things had to be reimagined this past year. So they are working well. Those safety pieces are in place. And again, we had a pretty aggressive ramping up to our hybrid model. It worked well. It gave us a chance to fine tune a few things, make sure we had children's safety and staff safety first. But it really is great to see everybody back now for the second week. So with that, that's the superintendent's report.
Thank you, Dr. Thompson. And those videos are great. So thank you to the students at the high school and then the principals and everybody else for the other levels in NCM. They're really great to see. Any questions or feedback from the committee on anything Dr. Thompson shared? Okay, moving right along. We do not have anything on our agenda tonight under budget. Just a very quick update. We are meeting as a budget subcommittee, again next Wednesday. So we will have more of a budget update at our meeting the week after. So next is some old business topics, starting with Dr. Thompson's goals. So you should have in your packet some of the same materials last time, just the background information around this, as well as the updated draft. So after the last meeting, Dr. Thompson and Maya and I met again and really worked on the goals and putting them into that SMART formatting that we need to do. Dave, do you want to pull these up so we can all look at it as we go through it?
Sure can.
Okay. As he's pulling that up, I just want to make sure that what I captured on here after our last meeting is in fact what everybody agreed to, because I think it is. But we did have a discussion around some decisions that we needed to make. So if you see in red, I believe that we all agreed on not weighting the goals, that we were going to have all the goals be equal to each other. And then the proposed timeline. So that our mid-cycle check-in, the formative assessment, which again is nothing written, it's just an agenda item, it's to be a discussion. That formative assessment would be March in 2021. And at that time, we would really discuss the work that has been going on from now until then, relook at the year 2 goals, make any adjustments or additions that we need to. And then the proposed cycle of the end of January 2022 is when Dr. Thompson's written self-assessment would be due to the school committee with links and references to the evidence that he'll be sharing with us throughout this process. End of January 2022 is also when we want the Google form sent to individual school committee members, assuming we stay with that method, which I think has been working really well, but I guess if there's another method we come across in the next year and a half, we could change that. Then February 2022, we would want our individual evaluations due so that we could have the composite draft document shared and discussed at our first March meeting of 2022. And then if we did not vote on the evaluation at that meeting, the second meeting in March of 2022 is when we could vote on the evaluation. And then the process would start all over again. But I believe I captured what we discussed. Any concerns or recommendations for change from the committee with this timeline? Everybody's good with it? Okay. The one question I had at the bottom, and maybe this is just the nature of the beast, but it just feels like with the way all this works, you're never really truly on a full 2-year cycle because there's this time period where you're submitting your evaluations and evaluating. Is that just part of how this works, or is there something that we need to adjust?
No, that's pretty much kind of how it is. You lose a little time making the goals, and you lose a little time doing the assessment. So,
okay.
So it's either stay on 2 years from beginning to end, or overlapping and losing 2 or 3 months, and then you're soon out of cycle. So,
okay.
Yep.
Just wanted to check.
Yep.
But the part that we really want to talk through tonight and make sure everybody's in agreement in, and then hopefully vote on, is the SMART goals. So, again, we had shared with the committee last meeting 2 student learning goals, 1 professional practice goal, and 2 district-wide goals. I won't read all of this word for word because you already had it for the last week and it is in front of everybody. But let's just go through each goal. So with the student learning goal, breaking it down in this timeline, feedback, questions, suggestions for change. Okay. So I guess we'll continue. Everybody good with the evidence for this first goal that we discussed at the last meeting as well? Okay. The second student learning goal, there was 1 small suggestion from Joan, which you can see in red, to just change the improve instructional practice at each level before it said grade. So we're just changing it to each level. And then you could see the proposed timeline for this goal. Feedback here. Okay, guess we can continue to scroll through. Everybody good with that evidence? So it was this second student learning goal where you can see in yellow we'll probably need to do more development of evidence in year 2. Year 1 is focused on really the professional culture piece of this school, but year 2 will need to be more data informed. So when we do the formative assessment in March, I think we'll probably have to have some discussion around the school in more detail for the second year. Okay, so then scrolling down to the professional practice goal. Any feedback on this timeline? You can just read my questions to Dr. Thompson that I bombard him with all the time. But from the committee, is everybody comfortable with the timeline here for the third goal? Okay. So then, oh, the one thing I did want to show here, if you can keep scrolling down, Dr. Thompson. So under evidence in red, Joan did request at the last meeting to make sure that we were including the family and student impact and engagement. So that is built into the timeline. But there is a piece of this that is contingent upon what ends up happening with the SOA funding, which hopefully we know more about in January. And then the resources we had discussed before as a committee and as a district wanting to contract out with the Essential School Solutions, which would really help our district implement more trauma-informed practice. So there is a component of this third goal with being more culturally competent that does tie into some of the trauma-informed work, but we didn't spell that out for year 1 because really the realization of that goal is going to be dependent on funding and resources. So what I put in this document, if everybody's comfortable with it, that this is something we could revisit in March at that formative assessment and then determine, is it feasible to add more of a benchmark for year 2 around this. Okay. So scrolling down to the district improvement goals. We're going to talk in a little bit about the middle school building committee update and the meeting that Dave and I went to on Friday, and another one we have this Friday, and a lot of the work that needs to be done there. I don't know if people want to ask questions around the proposed timeline now, or if you want to wait to have that more detailed conversation when it comes up on our agenda again in a little bit. There is quite a lot of work to be done with this goal, and in a short time frame. After the meeting that Dave and I had on Friday, I realized there's actually more work with this goal between now and the spring of 2021 than I realized. I thought some things were longer, farther out in the timeline, but they are actually needing to start to happen right now. But if everybody is comfortable with the timeline there, we can scroll down to the last goal. The last district-wide goal, which is around the strategic planning process. As Dave said, there is a meeting tomorrow with the strategic committee to reconvene and get this work started again. So that is reflected already on that first bullet point. But any feedback on this timeline around strategic planning? Okay. And there were no additional changes to this document around the evidence. So unless there was something that one of you wanted to add or change after our last meeting, the rest of this document is not edited. It's the same that you have seen at the last meeting. Maya?
I just wanted to let everybody know that we talked about the strategic planning, and what we put in here was some deadlines for when we thought it was important to really develop years 2 and 3 of the strategic plan. But we're not looking to add additional work beyond the work that we're already doing. The idea behind this strategic planning in years 2 and 3 is to kind of keep our work cohesive, so that like everybody's doing a lot right now to make the remote learning work, to make the hybrid model work, to and we want to make sure that we're kind of capturing some of that and getting some of the benefits of the fact that we are innovating so much, and so it's really more. I'm hoping that it's more a discussion about how to maybe put a little bit of some, goals and structure around some of the work that's being done, and maybe like a different framework around some of those goals, but not necessarily like additional work. We already have quite a bit of work to do to keep things going, in terms of this whole new way of thinking about educating our students. And as you mentioned, all this, the middle school work that is, those deadlines are really set by the MSBA. We don't have flexibility in that. So I just want everybody to know that we did kind of have a conversation about that, and we're not trying to add a whole nother pile of work. It's more just to kind of get everybody on the same page.
Mm-hmm. Yeah, thank you, Maya. I know I said it to Dr. Thompson and Maya in our small working group, but I'm a big believer if you're doing the work, you should get credit for the work. So all the stuff that is already happening, whether because it has to because of COVID or because it is things we were already planning to do, and we'll talk about this more as the strategic planning committee, should be embedded in that strategic plan. So at this time, is the school committee comfortable with this document as laid out before us? So we would want to vote on that timeline. We would want to vote on the goals as written, and then the evidence and indicators. Or is there any further work that the committee would like to see on this?
I just want to say phenomenal job. This is a lot of work compiling just these goals, evidence, everything here. It's a huge document. Thank
you, Dave. Yeah. Joan, I know at the last meeting you said a few times, how are we going to measure all this? Do you feel more confident about the timeline that we can measure things?
Yeah, I mean, I'm glad Maya said what she did about the strategic planning process and work, and trying not to add work, but instead trying to create structures around work, so that they can be appropriately recognized. I do recognize that we have later on our agenda the middle school building committee conversation, and so I wonder if it makes sense to postpone voting on this document until we've had that conversation, if the results of that conversation shift anything. Not that I think that it really will, but just in case.
Or we could just start talking about it now. I mean, is everybody okay if we just move that earlier and dive into that topic?
It's fine with me.
Okay. Sure. So as everybody knows, there is a middle school building committee, which Dave Catania is also on, and Alan Slater is the chair of that committee. I think there's like 10 or 12 of us on that committee. But at some point at the end of summer, there was a need to take a working group of that middle school building committee to be part of the designer selection process. And Dr. Thompson and Alan Slater and I are the three people from the district who are on this 16-person designer selection panel. So we started that process on Friday. In your packet, I did share with you the 6 proposals from the architect firms who are trying to be our designer for our new middle school. It is hundreds and hundreds of pages of information. I did not expect you to read it all. I have yet read it all. I have to by Friday, but I have not yet. But we just wanted to make sure that the school committee had access to all the information that we do. So Dave, do you want to scroll back up under that goal, the middle school building, since the dates are outlined there? Perfect. So we have another meeting on Friday, Alan Slater, Dr. Thompson, and I, with our project manager, who is Compass, to go through those 6 proposals and determine who do we want to continue to move forward with. So between now and November, what needs to be done, and part of Dr. Thompson's goals here, since he's a key player in this, is to participate in the designer selection process, including a presentation to the MSBA, which we are scheduled to do on November 3rd. And then there's potentially a second meeting and interview process on November 17th. What also needs to be happening as we choose our designer is getting ready to write a 40 to 50 page educational plan that really does follow under Dr. Thompson's authority and expertise. So between now and March of 2021, a lot of research really needs to be done. One of the timelines that caught me off guard, I thought was a little further away in this process, is actually when Norwood has to determine what grade configuration we're moving forward with. So as the committee and the community already know, the way the feasibility plan was written is that we are looking at both the 5 through 8 and a 6 through 8 configuration for the middle school. And I thought it was 2022 that decision had to be final. It's actually by the end of June 2021. So there is a lot of work on our plates as a committee, on the building committee, and especially under Dr. Thompson and his administrators with getting the research done and the educational planning process around the 5 through 8 and 6 through 8 possibilities. So what you see in front of you is that Dr. Thompson is expected to have the educational plan written between December 2020 and January 2021 at latest. When we talk about our long-term agenda in a few minutes, you'll see that at our second December meeting, we do have Alan Slater, the project manager, and the architect scheduled to come and give a presentation to the school committee and an update on some of this process. We are proposing that in February of 2021, Dr. Thompson will give us a presentation on the grade configuration pros and cons and what he's recommending. And we recognize that this really is a huge decision for our town. And we really want to make sure that we are getting the feedback from stakeholders and also educating our community on what the pros and cons are of 5 and 8 and 6 through 8. So in this proposal here, we are asking Dr. Thompson to start to do some community meetings and surveys and forums starting in December through March of 2021. And then you can see that what is required as per the MSBA, so we do not have any flexibility here in this timeline, is that we have to submit the PDP, which is the preliminary design plan, in March. And this includes that information on that educational plan, the programming, and the initial space summary. This bullet I just pulled directly from the MSBA materials. I did not come up with that language. That is what they say has to be submitted in March. And then between March and June of 2021, the work of the middle school building committee and Dr. Thompson's critical role will continue with educating the public with forums, presenting again to the school committee definitely by May of 2021, if not before. And the expectation is that we as the school committee will vote on the grade configuration for the new middle school by the end of June of 2021. Which sounds further away than it is. And then in July 2021, the next round of paperwork and reporting is due to the MSBA, and this is the preferred schematic report. So this builds on the PDP in much more detail. My understanding at this time is that we then have to go back to the MSBA for another meeting next August. What is not entirely clear to me yet is all the work that has to be done between August and January. I know it's going to be a lot. We just didn't dive into that timeline yet. I think some of it depends on how are things going. So probably when we do a formative assessment in March, we would fill this timeline in a little bit more. But then in January of 2022, the work to get ready for the town meeting in spring of 2022 will really need to be finalized because it will be in April 2022 and town meeting happens that we would need the town meeting vote. And then hopefully we secure that vote and then we move forward. But that timeline isn't in here because that would be the next evaluation cycle. So there's a lot. Questions, discussion?
This is a huge undertaking. Is there, I'll state the obvious. Is there any flexibility? Like, I know that you said that we are not in charge of the dates and the driver of it, but is there a possibility to delay around or something like that, given the fact that we're just coming out of COVID? Or no, we're in the process and we're in the process. We're in the process and we're in the process. Okay.
My understanding is if we try to delay, we're out. and I don't think we want to sacrifice the fact that we're in. Maya?
I agree with you. Like, what, you know, when we were there for the preliminary, you know, when we first got chosen, it was clear, like, you can step out at any time, but then you go to the, you know, you just would have to start the entire process all over again. And there's no guarantee you would ever get picked to come back into the program.
Right.
With that being said, I do think, you know, I do have some question as to what's going to happen with MSBA funding because of all of the issues that are going on with the state budget in general. I mean, it is October 7th and we still don't have a state budget for this current fiscal year that started July 1. But I think we need to assume that we need to stick to these deadlines until we hear differently.
Yeah, we briefly asked on last Friday with Compass, who was our OPM, if they heard anything about any MSBA funding or any changes to anything, and their answer was no, not at this time, that they are expecting this is the process, this is the timeline. But I did read some stuff separately, not in that meeting, just in you know, dialogue around state funding, that you're correct. Unfortunately, we don't know what the MSBA funding will definitely look like. Dr. Thompson, do you have any other information on that piece or thoughts on that?
No, we have to. I mean, we have to stay the course. If you know, it's kind of like do not pass go, do not collect $200. I mean, you're out and you start all over again. So it's just keep going and keep working on it until we get new information. That's the best we can do. Like everything else.
Was there anything in particular around the middle school, whether it pertains to Dr. Thompson goals or just in general, that the committee had questions or concerns around, or that you want Dr. Thompson and I to take back to our next meeting on Friday? Maya?
The only thing I think is, as we're starting to think about the community engagement and you know, talking about the different grade configurations, I think we're going to have to we really need to be reaching out to younger families. I think when people hear like, oh, this is a middle school project, they think it applies to, you know, middle school parents, but current middle school kids will never see this new middle school. Right. It's, you know, it's like the preschoolers who this is going to impact most of all, you know? And so I think we're going to have to think about ways to kind of get that message out to the younger families that I remember when I had a 3-year-old, middle school seemed really far away, but it's first it happens faster than you think. Yep. And building construction is slow. So it's going to be a while.
No, that's a really valid point. And, you know, that piece, the family engagement, the community engagement, you know, although it's embedded in this process, that timeline is a little bit more under our ability to adjust. We ultimately need the information to put into the reports, but I think we have more leeway there and exactly what we're looking for. What we did discuss with Mr. Slater and the 3 representatives from Compass on Friday is, again, they're going to come to our 2nd December meeting. There's also going to be some middle school building committee meetings that Mr. Slater is going to be organizing in between now and then as well. But we will know who the chosen designer is by middle of November. And part of their role is also to help us educate the community. And, you know, they should, hopefully, if we choose the right people, have the expertise in this educational planning as well, and can help us get some of this research out there. So we did talk about on Friday at earliest some public forums, or just around the education of this in December, but then doing a lot more of it in early 2021. Any other questions specifically around the middle school project? Project manager did recommend that, you know, we just focus on this and make it a priority, and that I should try to clear our agenda for other topics in all of 2021. That's not going to happen, but that was a recommendation that I heard on Friday. This will start to be, as you can see on the long-term agenda that we're going to talk about in a few moments, a reoccurring conversation, and probably at every meeting in 2021, as there's a lot of important work that needs to be done. At this time, does anybody want to make a motion around Dr. Thompson goals?
I'll make a motion to approve.
I'll second that motion.
Thank you, Joan. Any further discussion? And just so I'm clear, and it's clear in the minutes, Dave, you're recommending like proposing this whole thing as a package, right? The timeline, the evidence, the goals, everything in front of us.
Get it
Correct.
done.
And my apologies to Dr. Thompson for putting all this on you, sir.
No, it's work that has to happen.
Yes.
Yep.
Okay, so.
Yes, I am proposing all together.
Okay. And Joan, you're good with that as you second it? Okay. So all in favor?
Aye.
Aye.
Okay. Okay, great. 5-0. Dr. Thompson, anything you want to say about your goals?
I'm going to start as soon as we get done with this meeting, because there's a lot to do.
There's a lot to do.
Yep.
And a lot of it ties into tomorrow's meeting around strategic planning. So we are being very mindful that everything in the district comes together.
Yep.
Which does lead us to the next topic on the agenda, which is the long-term agenda document for the school committee. I finally feel like we're in a place, I think, where I can plan meetings better. Although, not having power at 6:15 gave me a moment of panic of, are you kidding? I have to switch the agenda already, but we did not need to do that. So the long-term agenda document that you have in your packet tonight includes all the dates that we have previously voted on, through the end of June. And I started to plug in some different topics and presentations based off of conversations. But at the end of the document, I do still have a pretty significant parking lot of topics and work that need to be scheduled. So I didn't know if there was anything at this time that stood out to the committee, a certain topic that you wanted to discuss more, just as where it belongs in the agenda. If you disagree with what is being proposed so far, if you think that I've missed an important topic that we need to get on there. Dave and I worked on it. Dr. Thompson and I worked on it together last week. Yeah, Anne-Marie?
Did we have, I'm just looking through here real quick. Did we have, I see looking at extended day fees, did we have building fees on here? Because I know that was something that Karen wanted to talk about.
Yeah, that's a good question. It's in my parking lot. I couldn't find the document when we voted on the fee schedule in July. I know we approved the timeline. I couldn't find that, and I do have to get it in there. If anybody has that document that you can easily forward me later, please do. Otherwise, I'll just continue to look for it. But yes, we do have to get that on. The reason I put the extended day fees for the December meeting is because we only voted on the fee structure through December, and we said that we would come back and assess for the new year. So that's why that's there for the December 2nd meeting, in the event that we need to talk about it again December 16th. Is there anything else at this time that anybody wants to look closer at? Well, agenda is something that we are permitted to speak about outside of public meetings. So as always, if anything comes up, call me, email me, and we can continue to work on this document. Dr. Thompson, in the past, I made a copy of the long-term agenda that we shared with the administrative team. Are you okay if we do that again, just to get their feedback, or if there's anything they think we're missing?
Yeah, we don't have a meeting until a week from today, so we have some time to do that.
Okay. All right, so if everybody's good with the long-term agenda at this time, moving along to the next topic is capital outlay. Anne Marie went to the capital outlay meeting last week as our representative. So do you want to give us an update of how that meeting went?
Sure. Yep, so we met last week, October 1st. And so basically, as far as it pertains to the school committee, was not too eventful. If everyone remembers, back in the spring at the special town meeting, we actually, as a town meeting, decided to move all the capital improvement plan voting until the fall to the fall. Actually, I'm sorry. The Capital Outlay Committee decided to move presenting to town meeting the capital improvement plan until the fall, just due to the meeting having to be run the way it was. However, the school committee did put forward at the special town meeting requests for funding for 4 special needs vans and some improvements to the high school IT purchases, including some projectors and things of that nature to replace some obsolete equipment, which was approved. So essentially at the meeting that we had last week, it was voted on by the committee to remove those items from the capital improvement plan that would be presented to town meeting in the fall. And it was replaced with some other items that the town is looking for, but at this time, the schools have not asked to add anything additional to the capital improvement plan, since we had already, we were able to obtain some of the things we were asking for already in the spring.
Thank you, Anne Marie. Were there any questions, feedback from the committee on capital outlay? Anything you need from the committee at this time, or the administration, Anne Marie?
Nope.
Okay. Well, thank you for being our representative on that committee. We appreciate it.
No problem.
It's been Maya for quite a while. So Maya, thank you for all the work.
There's not enough committees. Happy to help.
Okay, so there's no policy tonight. We do have a policy subcommittee meeting tomorrow, Dr. Thompson and Joan and I. So we will have some policy work that we will bring back at the next meeting. We already covered our new business, the middle school building committee. So that brings us to the consent agenda. Dr. Thompson, donations?
Yes, we have one donation from Costco. They have donated 85 backpacks to distribute to students who need backpacks. So,
Is there a motion to accept this donation?
So moved.
Thank you, Dave. Is there a second?
I'll second.
Thanks, Maya. Any discussion? All in favor?
Aye.
Aye.
Thank you,
5-0.
Costco.
Great. Yes, thank you. Okay, so at this time, school committee addenda. Joan, did you have anything this evening?
I have no addenda at this time, except keep wearing masks so we can stay in the green. Yay!
Yeah. Thank you. Anne Marie?
Not this time.
Thank you. Maya?
Nothing this evening.
Thank you. Dave?
Short statement. So very special thank you to our Norwood Light Department. Your quick work tonight was an immense source of pride and greatly appreciated by all of us. I thought we weren't gonna have a meeting until you guys, in less than 45 minutes, fixed the power. So thank you very, very much. So I've been saving something here because now everyone is back. So welcome back, everyone. And so we begin a new school year during this unique time in the history of our nation. Hopefully you and your families are and will continue to stay healthy during the months ahead. Your vigilance wearing masks in public is appreciated as we all do our part to limit this virus from spreading. It is also recommended that everyone get a flu shot, so please get one this fall again to help protect yourselves and our many vulnerable citizens. Please know that as a school district, we will do everything that we can to continue to provide our students with a safe and inclusive learning environment. To all of our new teachers, welcome to an amazing community and to our school district. We are so glad to have you on board. I also applaud all of our hundreds of returning employees. Welcome back. Thank you for all your hard work getting this year off to a running start and for your indomitable enthusiasm as together we tackle the challenges ahead. This pandemic has made it clear that the schools are not just a dozen years of education. Schools are the very pillars of our community. So I want to take a few minutes tonight to recognize the extraordinary efforts of everyone working for our district. It is because of you that Norwood is a place that we are all so proud to call our home. Thank you.
Thank you, Dave. That was a great statement, and I agree. I don't have any official addendum tonight at this time either. So that does mean at 8:40 we can adjourn. We already had executive session before the meeting, and we do not need to go back into executive session. Is there a motion for adjournment?
So moved.
Thank you, Anne-Marie. Is there a second?
I'll second.
All three of you. I saw everyone's up, so that was second, third, and fourth. So all in favor.
Aye.
Aye.
Aye. All right, great. So our meeting tonight is over, and we will see everybody again in an official meeting in 2 weeks. Have a good night, everybody.